question.
Yeah.
DDT has been banned for quite some time. Is that still a problem?
It's still a problem because it's very persistent, and it's a problem because they're using it again in Africa, throughout the continent. Historically, DDT was used here in the States, but it never made it to Africa. And so they have an increasing problem with malaria, and because of the poverty, because it hasn't been sprayed in the past, the EPA is using it, has worked with the World Health Organization, and has said it's fine to be used in spraying in the homes, etc. The problem is that it persists, and even though it's being sprayed in a contained way, it travels. And so is it a problem right this minute? Not really, but it's an emerging concern because of the increase in malaria in Africa. Good question. It's very costly when we look at environmental exposures as it relates to disease. An article was written by a well-known child environmental scientist, Phil Landegren, in 2002. And it was estimated that $43.4 billion is spent every year for lead poisoning. We have a great program in southeastern Wisconsin through the Milwaukee Health Department, but it's still a huge problem in our state. $2 billion for asthma, $0.3 billion for childhood cancer, and $9.2 billion for neurobehavioral disorders. The U.S. Department of Education spent $36 billion on special ed services in 1996, and those estimates continue to go up as we get more and more children that are diagnosed with learning disabilities, all the way up to autism.